the healthcare plan. Trump, many years, said it was going to be available in 2 weeks. It's ready. It's being produced right now. We're just copying it off. The dog stole it, ate it, or whatever the case may be. But is it finally out? I'm going to argue that the plan has been out forever, for decades. The Affordable Care, we're going to get into the Affordable Care Act, and we've got some very good news on Medicare. So regular viewers know a slide I've shown that there's going to be over $500 billion cut over the next few years in terms of Medicare, your Medicare Part A, Part B, C, D, the whole 9 yards. We've actually got some good news. They stuck something in at the last minute in the continuing resolution. Usually it's something pretty nasty. Well, they added some nasty stuff in there too, but it's actually good for Medicare. All right, but let's Medicaid, not so much. It's still $1 trillion. That's going to affect everybody, even if you're not on Medicaid, because there's going to be millions of people without health insurance that are going to go to the hospital, and they're not going to be able to pay, and the hospitals are going to get stuck with it. We're all going to get stuck with it. So the prices are going to go up. But in terms of the Affordable Care Act, they have tried over 70 times to repeal the Affordable Care Act. And so that's the plan, okay? The number one plan is to get rid of Obamacare, the Affordable Care Act marketplace insurance. And then people always says, okay, what's your replacement? What's the plan? And I have always argued that the plan is there is no plan. The lack of a plan is a plan. It's kind of like when you're talking with your friend, hey, what are you going to do this weekend? Oh, I'm going to cut the grass and change the oil in the car and do a little housework, whatever. And what's your plan this weekend? Oh, nothing. I don't have any plans. That's your plan, to not have any plan. So that is the plan for the replacement of the Affordable Care Act, to go back to how it was before the Affordable Care Act. And let's do a little stroll down memory lane to see what it looked like before the Affordable Care Act, what the Affordable Care Act changed. A lot of people think, oh, I have Obamacare, and nobody has Obamacare. Nobody. You have a plan from a company, a private health insurance company. If you have the Affordable Care Act, you have a plan with a private insurance company that is regulated by some of the provisions of the Affordable Care Act. And those are the provisions that they're trying to get rid of. So let's talk about those provisions right here. These are the biggest provisions, what it actually does. So those of you who remember, in the old days, not very long ago, before the Affordable Care Act in 2010, if you had a pre-existing condition, sorry, no health insurance for you. No soup for you. No, you're done. Rejected. You're already sick. Too bad. No health insurance. Go do whatever you got to do someplace else. If you are healthy and they're nice enough to give you a health insurance plan, which is only good for 1 year, and then you get sick, too bad. You're sick. We're not going to renew your plan for next year. You're costing us too much money. So there's this idea of we need to bring back these high-risk pools. What's a high-risk pool? A high-risk pool is you basically have two pools of people, a whole bunch of people over here that are relatively, young and healthy and stuff like that. And so they're paying really, not too much for their health care, right? Got a whole bunch of people over there because the health insurance companies don't allow people that are sick into this group. So health insurance companies are making tons of money. We'll get into how much, the old days, how it happened. And so the monthly premiums were very much because they were all healthy. The unhealthy people were put into a high-risk pool of a bunch of unhealthy people. And those premiums, even if you were allowed in there, if you were too unhealthy, then they wouldn't even let you in there. But if you're a borderline, pre-existing condition, we're the only country in the world that uses these word pre-existing conditions the way we use it. But if you have any type of issue, then that's serious, you don't even get into it. But if you're kind of borderline, you're not healthy, but you're going to cost the insurance company a little bit more money, then they put you in a high-risk pool and they charge you a whole bunch of money. So that's the high-risk pool. So if you're healthy, it's a beautiful thing. But if it turns out you get old, and if you're lucky, you will, and eventually you'll get sicker, and then you just might move from one group to another group and have to pay a whole bunch more. And that's the reality of it before. Remember the old news stories from 15 years ago and the children just born? I've actually got I pulled up some old newspaper articles of Let's see. Let me pull up some of these old newspaper articles. This is from 2010. Newborn denied health insurance coverage days after life-saving heart surgery. So Houston Tracy, I don't know if anybody remembers Houston Tracy, a 12-day-old boy, not 12 years old, but 12 days, denied because of her pre-existing condition. Transplant decisions, too late, teen dies, denied by the health insurance companies. So again, as long as you're, healthy-ish, and you're paying premiums, the insurance company's making good money. But as soon as something happens, you get sick, then they could kick you off. With the Affordable Care Act, when that passed, couldn't do that anymore. There's no more lifetime caps either. Before they would say, okay, even if you get sick, we'll keep you, but we're only going to pay, $100,000, $200,000, $300,000, or whatever the case may be, and then you're done. You have to fix everything, and after that yourself. And then before the Affordable Care Act, they could kick off a bunch of people or not cover things like pregnancy, mental health, preventative care. But with the Affordable Care Act says, hey, if you have a healthcare plan, that you have to cover these 10 essential benefits. And so doctor visits, hospital, meds, maternity, mental health. Okay. Here's one of the big ones. Here's the one reason these health insurance companies want the Affordable Care Act repealed. They tried 70 times. These are not, they're politicians, but they're doing the bidding of health insurance companies. And the reason these health insurance companies predominantly want these gone is because of this next one. According to the Affordable Care Act regulation, 80 to 85%, it depends whether it's a company or it's individual, 80 to 85% of your premium that you pay has to actually go to healthcare. So if you're paying $850, or let's say you're paying $1,000, 850 of that actually has to go to healthcare, for you or whoever else in the pool. Before that, not really regulated. So over 50% of some of these plans, the money that you paid in the premiums went to advertising, bonuses, yachts, shareholder value, dividends. So 50% of what you paid didn't even go into healthcare. The Affordable Care Act says no. If you're going to have healthcare, then 80 to 85% of that money actually has to go into healthcare. And these companies, that's the one thing they want to get rid of the Affordable Care Act big time. They just want it done, and they want to go back to the old days like this. So because of that, if the company doesn't spend the required amount, the percentage, 80, 85%, then they have to refund that money. And since 2012, billions have been returned. If you've received a check from your health insurance company, type it in the comments and say, oh yeah, I got my check. That's where it comes from. It's because that health insurance company spent too much on, CEO bonuses or new yachts or whatever the case may be. So, and then we all know about they changed it. The young adults kids can stay on their parents' plan until 26. Another 3 million people covered because of that. Already talked about no lifetime or annual caps on essential benefits. So in the old days, 15 years ago, you get cancer or something like that, and you get, have to have really expensive treatment, they'll just kick you off. So, or they'll say, well, no more. You've reached your limit. In terms of prices, and how is all this going to pay? Well, insurance is a pooled risk. The more people you have in a pool, the larger the pool, the cheaper it is for everybody, right? That's why we have like Costco's and stuff like that, right? Bulk purchasing. So that's the Affordable Care Act. That's how it got prices down, was this kind of bulk purchasing where you've got a giant pool of people, each paying premiums. And if you got really sick people, no problem. You got a whole bunch of healthy people. Okay. So that's how it went. Until 2018, the previous Trump administration, they tried 70 times to get rid of the Affordable Care Act. They couldn't. So they pretty much hamstrung it. And how did they do that? They said, okay, no more individual mandate, freedom, right? Anyway, so no more individual mandate. Well, not technically, they just set it to zero. They couldn't get rid of the individual mandate because it was passed by Congress. So they just said, okay, the individual mandate is zero. Some states do have a mandate that you have it, but nationally they don't. So a lot of people that are healthy, young people, when you're young, you're indestructible, you live forever. So you don't get health insurance until you need it. So a lot of people just left. And because the individual mandate was set to zero, a lot of people left the pool, and the people that actually needed healthcare stayed in, and that rose the prices for everybody. So that's kind of where subsidies really started taking off, because the government said, okay, we had the mandate, and that was really helping to bring down prices. But hey, if you need help with Medicare, Medicare Advantage, Medicare supplements, Part D plans, make sure you reach out to my partners at Chapter of Medicare. I looked for a place that would help y'all out, and Chapter of Medicare knocked it out of the park. They've got excellent customer service. They look at every single plan in your area, and their help is always 100% free. Give them a call and they'll see if they can help you out, and tell them Dr. Ed said hi. They decided to kill those, basically. So we need to help people and get them, we need more people insured. So that's when they started really focusing on subsidies, which they have now, that they're trying to get rid of these subsidies. That's the reason why we had the shutdown, for the longest shutdown in US history, is because they were attempting to extend the subsidies. But it looks like not so much. They kind of caved in. So when you have the subsidies, fewer people were enrolled, okay, with the NOAA mandate. Risk pool got sicker, so premiums rose in 2019. The subsidies stepped in, shielded 80% of buyers, and later surged enrollment to a record 21 million. So we got millions and millions and millions of people covered because of the subsidies that weren't covered before. But now we're looking to kick those people off. And again, just the same thing on Medicaid. When you kick people off Medicaid, they're not going to, it's not as though they're not going to get sick or be injured. They are going to get sick and be injured, but they just don't have to pay for it. They're going to go in medical debt, bankruptcy, but they're still going to go to the hospital, and the hospital's going to get stiffed for that bill. And are they going to take the hit? Of course they're not. They're going to pass it on to the rest of us. So even if you have health insurance from work or wherever the case may be, you're going to get increased prices every time millions of people get kicked off. So that's the plan. No, make no doubt about it. Every day that they don't have a plan, that's the plan, to not have a plan, to let you go out there and of your own devices. And I'll talk about his recent statements about you're going to go out there and be little entrepreneurs. I'm going to talk about that today, and that's not a plan. Anyway, all right. So we do have some good news before we get into some questions on all things Social Security, retirement, survivor benefits, and all the rest of it. We do have good news, is that they did pass the pay-go stop measure. Let me see if I can find my little slide here. It's basically, okay, here we go. Here's what I've been showing for the past few months, is that because there was a deficit because of the one big beautiful bill, they give trillions of dollars of tax cut to the rich and the powerful corporations, and they had to find that money elsewhere. So they cut Medicaid, cut food stamps, cut Section 8 housing, but that wasn't enough. They still had a humongous deficit because of it. And part of the Pay-Go Act, the automatic cuts have to go to Medicare, over $535 billion, because in the one big beautiful bill, one big beautiful billionaires bill, they didn't stop that, suspend that. But in the continuing resolution, they did. So we have some good news that as of now, Medicare is safe-ish from over $500 billion in cuts. So we had some good news there. Some rare good news in this economy. All right, let's talk about what you got going on here. Let's see, get some questions. Anastasia, ACA was my only choice when I was widowed at 60, age until now. I turned 65 in October, on Medicare now. Yeah, a lot of people are very, very happy to get on Medicare. If I was dictator for the day, I'm joking, that's the first thing I'd do, Medicare for all. Or at the very least, start Medicare at 60 or whatever the case may be. There are plans out there. There's short-term medical. And I see a lot of TikTokers and social media talking about these. And they said, okay, if your Affordable Care Act premiums have, doubled, tripled, whatever the case may be, and you can't afford them anymore, they're these short-term medical plans that are good, supposedly good for 3 or 4 months, but then they were extended for a year, and then you can extend them for another 2 years. And so the law is all over the place on these, but there are a lot of people advertising out there, these plans, these short-term medical plans. But yeah, they are super, super sketchy. They are insurance, but if you get sick, yeah, good luck. If you have to pass underwriting to even get one, there's so many limitations. It doesn't cover this. It doesn't cover this other thing. If you get sick, they can kick you off. So all of the provisions of the Affordable Care Act don't apply to those. So I would definitely think twice, 3 times, 5 times about checking out one of those. Yeah. If I didn't have the AC, I would not be living today. Wow, Bella. Wow. It looks like I will be without insurance until I get Medicare, just like many others. Yeah, we definitely, I mean, I'm sure a lot of people in our community reach out to their politicians, and once they found out about Medicare cuts being happening, they said, hey, y'all need to do something. So we were able to accomplish this. Got a community over 600,000 subscribers, and they reach out to their politicians and make their concerns known. Yeah. Keep smiling. I don't agree. Your premium should be more if you're sick. That's crazy. Yeah, again, the pooled risk, if you got a giant pool, then everybody's premium pretty much the same, because, you're healthy one day and the next day you're not, and your income didn't change. Actually, if you get sick, your income actually might go down because you're sick.